9 a.m. Welcome to the Reno County Commission meeting for Tuesday, February 28th. Call the meeting to order. First item, as always, is the Pledge of Allegiance and a prayer today by Chaplain Richard Haley.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Shall we bow? Our gracious Heavenly Father, we come this morning before you. Thank you for a beautiful day. Thank you, Lord, for each one here. We ask your blessing, Lord, on each one as they go about their work today. Lord, bless the commissioners as they, Lord, do the work that they've been called to do. And we just thank you, Lord, for this opportunity to live in this community, to serve you, to understand your grace in our life through Christ our Savior. And we ask all of this in the name of Jesus Christ. Amen. Thank you again. Thank you. Yes.
Welcome again, everyone. I'm going to squeeze one thing right at the top here. The district attorney's here. I know he's always busy. He has a introduction to make and maybe a few other comments.
Thank you. It is my practice when I hire a new attorney to bring them over and introduce them to the commission so that as he's walking around the courthouse and as he sees you, you'll know who he is. So Kyle, this is Kyle Byfield. He's the newest attorney in my office. I'll let him introduce himself.
Like I said, just Kyle Byfield, started with the DA's office on February 6th. Worked out at the Kansas Law Enforcement Training Center for about 3.5 years. And then prior to that, worked in Sedgwick County doing criminal defense for about 4 years. So.
Welcome.
Welcome. Thank you.
Happy to have you here.
You put the white hat on now. The only other thing I have is I originally thought we were going to be looking at the contract for the remodeling today. That's not ready. Next week I'll be out of town. I'm at a conference and presenting. So I'll send Andy. But if you have any questions about that remodeling effort, feel free to contact me or send a question to Randy, and I'll answer anything that you might have to ask about that issue. Okay?
Any questions for the district attorney?
Yeah. I think Commissioner Whitesell's coming over to the office so he can ask me whatever he wants to.
Good.
And I think I've met toured the office with you guys. So
Yes.
Well,
yes,
I do know we do know it's a fairly urgent matter to get that started, and I think Randy's working hard on that. And
hope to have the contract for you guys next week.
And I will tell you good news. We had rain, and And I didn't have any leaks in my office. That was, whatever they did, nothing came through the roof in my office. So I'll be able to get the plastic up. So
we've taken a step forward.
Yes.
I think I'll just adjourn the meeting right now.
Lot of good done.
Thank you all very much. Appreciate your time.
Thank you. Let's see. So we'll move on to public comment for items not on the agenda. I think the chamber is here. Deborah, you have something?
I do. Good morning, Commissioners. Thank you for allowing me to speak during public comments. I brought some packets of information for you today, mostly because we are about to enter the month of March, where there are a lot of things happening that we want you to know about. But before March gets here, yet today, one of the things I will leave you is some information about the Downtown Hutch Master Plan Visioning Workshop. Randy was given an email with a little bit of detail about it. That first visioning workshop is this evening. It's a virtual workshop online via Zoom. And if it's not too late to sign up, if any of you would want to participate in that Zoom, there will be breakouts, and we will have a way that if multiple commissioners wish to participate, you can be in separate rooms to provide some input to the Downtown Hutch Master Plan. There will also be an in-person opportunity in April when the consultants are here in town. So we would invite you to look at these dates and get them on your calendar and take part in that. Also this week is the awards night for our Hutchinson-Reno County Chamber of Commerce, and we will be giving 5 big awards that night to multiple businesses across the community, from a Rising Star to our Small Business of the Year, the Legacy Award to businesses who have persevered over decades in the community, Ambassador of the Year, as well as the Minority and Women-Owned Business Award. If you don't have tickets for that, we do still have a few seats left. It's March 2nd, the evening at 5:30. The reception begins, and then it'll commence with the awards ceremony. I'm also putting in your packet the list of tourism events that are coming up in March, because it is a big month for us from a tourism perspective. Starting this weekend, the National Christian Homeschool Basketball Tournament, we have been the home to it for the last 2 years. It is back here starting this Thursday. It will bring in 86 teams from across the country and about 3,000 young players and their families. So it's a big economic impact to the community. So you're welcome to come out to the sports arena and see that in action. Plus, there's a link in your packet for how you can get tickets for the NJCAA tournament that will be here later in March. Also in your packet, I've put the new Visit Hutch Tourism Guide for the year in here, as well as a report that we do for our economic development stakeholders. I'm going to welcome an opportunity to visit with each of you one-on-one later this month, hopefully on March 21st, about some of the work that we do in economic development that maybe we don't get a chance to talk about as openly here in the session until they come to fruition. So there's information about that. Also, just know that the last weekend of the month, we are for the first time hosting the Kansas Ag Expo. It's a new event on our state fairgrounds. So welcome that event, and Commissioner Hurst was instrumental in helping us win that event here in Hutchinson and at the state fair. And lastly, we've been spending some time on our county's behalf in Topeka. In January, we applied for base grant funding, hopefully for an infrastructure piece that will help take the water line from Hutchinson down to serve a new industrial park under development, and hopefully solve some of the water issues at Yoder and along the K96 corridor. We can't promise anything. It's a really competitive grant, but we've been doing everything we can to advocate for Reno County on that. So those are just a few things that I wanted you to be aware of, and I will leave a packet for all of you. I'll leave these with Randy, and then he can get them out after the meeting. Thank you.
Any questions?
All right.
Thank you.
Thanks so much.
Thank you.
Any other comments for items? Carrie?
Good morning, Commissioners. I'm Carrie Mayu, 10 Whitmore Road, Hutchinson. And on behalf of our local health coalition, Heal Reno County, I want to invite you to the premiere of a local documentary, On the Table, this Friday, March 3rd at 6 p.m. at the Fox Theater. Since 2016, Heal Reno County has partnered with Blue Cross and Blue Shield of Kansas on the Pathways to Healthy Kansas initiative. In Phase 1, we work through partnerships with schools, businesses, restaurants, grocery stores, and cities to leverage $400,000 in grants to support increased access to healthy eating, physical activity, and tobacco cessation. Now in Phase 2 of the Pathways Initiative, Heal Reno County continues to work through partnerships to leverage an additional $200,000 to impact the social determinants of health. Those are the social, physical, and economic conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. These social determinants of health are categorized as economic stability, community and social context, neighborhood and built environment, healthcare, education, and food. One of the main focuses of our efforts the last few years has been on access to healthy food and food insecurity. Food insecurity is defined as a household-level economic and social condition of limited or uncertain access to adequate food, which has been shown to increase the risk of diabetes, heart disease, and obesity. In 2020, 13.8 million American households were food insecure at some time during the year, and in Reno County, around 1 in 8 residents and 1 in 6 children are food insecure. In spring 2021, we conducted interviews about perceptions and experiences with food insecurity in Reno County. We found that employment wages were the main barrier to healthy eating for over half of the respondents. For people who are food insecure, a combination of limited awareness of available food assistance and negative personal attitudes about food assistance were shared as barriers to healthy eating. And about half of the interviewees said that transportation was a barrier to healthy food access, especially for those who need to use public transportation. This data and feedback led us to be more curious about the experience of food insecurity in Reno County, and we accessed Pathways to a Healthy Kansas implementation grant funds to do a storytelling project starting in fall 2021. After nearly 18 months and quarterly interviews with 6 local people experiencing food insecurity, we are ready to premiere this documentary and spark more conversations about what it takes to put food on the table in Reno County. The film was produced locally by Observant Media and features all Reno County residents and resource partners. We are excited that Friday's event will be emceed by Commissioner Hurst. You ready?
Comment regarding that.
Okay.
You all are welcome to come because Randy asked me this morning if I was going to sing or dance, and I can approve that neither one will happen.
There's still time to convince you, though. Okay. Commissioner Hurst has contributed to establishing more collaboration to food access and food policy in Reno County over the years, so we're grateful to have him as part of this. In addition to the film itself, the event will feature an onstage conversation between the filmmaker, Ryan Corwin, and the film's participants, as well as an update on the Pathways to a Healthy Kansas initiative. We're also going to invite the community to join Project Upstream in partnership with the Reno County Food Policy Advisory Committee to engage in an action learning experience on identifying solutions to food insecurity in our community, based on the book Upstream, The Quest to Solve Problems Before They Happen by Dan He. As the Board of Public Health, we hope that you will find value in this effort to personalize one of our community's health challenges and move toward actions that will not just solve the problem of food insecurity, but create food security for all people in Reno County. So thank you for your time, and thank you to Commissioner Hurst for singing and dancing on Friday and your support of this project.
Thank you, Gary.
Yeah.
Mr. White.
Yeah, so ARCAT has a program where we deliver groceries to people out in more rural areas. I just wanted to make sure that that was part of our plan.
Yes.
Okay.
Yes.
Perfect.
Yeah, that's part of the system.
Okay, awesome. Thank you.
Any other questions for Carrie? Thank you.
Thank you.
Thank you, Commissioner Hurst. Other public comments not on the agenda? Hearing none. Does the commission have any additions or revisions?
I'd like to take 6I, 6J, and 6K out of the consent agenda.
I should just make a motion for that, Commissioner.
I'd like the motion that we take 6I, 6J, and 6K out of the consent agenda and add them to normal business.
Motion by Commissioner Weitzel to move 6IJK to business items. Last call and second. Motion fails for lack of a second. Any other items on the agenda for revisions?
Yeah, so for people not, or for people at home, I got with both Randy and then the IT guy, and online The only thing that's available right now for this week is the agenda. The supporting documents are not available online for people, but they've told me that they are working on getting that fixed. So,
Thank you, Commissioner. Hearing no other items, we'll move to 6, the consent agenda, the regular consent agenda. Is there any comment or a motion to put this?
To get it started, I would move to approve the regular consent agenda as provided by staff.
Commissioner Hurst moves. Is there a second? Commissioner Bogner seconds. Discussion on the consent agenda.
So, just so the commission is aware, 5 of the appointments that we're making under this consent agenda are registered Democrats, so, this being an all-Republican board, and these positions having a good amount of sway in the community, I just wanted to make the commission aware of that.
Commissioner Hurst?
In my mind, regardless of what party you're affiliated with, if you're qualified and have been approved, in my opinion, that's sufficient enough. If there are other people that want to apply for these positions, they should do so, because we make it public within the availability of all people and give them 60 or 90 days to do the request for being considered on these different boards. But I appreciate what you said. Maybe that'll help get more people interested in seeing what these boards do and whether they want to come and be part of, apply for it. Okay?
Thank you, sir.
I would like to respond, Commissioner Weitzel, to your comments too. I tend to agree with Commissioner Hurst. At this level, well, number one, I disagree that they have significant sway in the process. I think they're advisory at best, and any sort of policy decisions come to us anyways for a final decision. And I don't really look to the partisan nature of these people, given this is a nonpartisan board. So it doesn't really matter to me either, as long as they're qualified and not entering into partisan politics as part of their work here. I think, and I haven't heard that from any of these people. So, any other comments on this item? No. Hearing none, roll call, please.
Commissioner Hurst?
Yes.
Commissioner Parks?
Yes.
Bogner?
Yes.
Commissioner Weitzel?
No.
Mr. Friesen?
Yes. Motion passes 4-1. Next up is a laundry list of fire district items. Most of this is related to disposal of obsolete equipment, as well as a few new purchases. Randy, do you have anything to add?
All of the, the surplus items, all of those are past their useful life. So that's why they're on here. They're not to be used by any other fire districts or departments. And then there's a couple purchases of new tender trucks and the UTV that are within the capital budgets of those respective districts.
Is there a motion to get this started?
I'll motion that we accept the special district consent agenda.
Commissioner Parks makes the motion. Is there a second?
Second.
Second by Commissioner Weitzel. Discussion? This is definitely a change from the way it used to be done. Every fire truck in the county used to be discussed every time it came up, didn't it, Commissioner
Yes,
Hurst?
it did, and I think I was glad to see, in my perspective from being out in the country, that I believe, am I correct, if I read this correct, that one of the winning bids was a local Reno County business. Is that correct? Or did I misread that?
Yeah. Good morning, Travis Vogt, County Fire Administrator. So we put out, we requested 3 bids for the UTV project. One of the vendors was in Salina. The other one, I believe, is around the Salina area, and then one is a local Reno County company. And they were the Reno County company. Prairie Poly Manufacturing was the low bid. I personally worked with his equipment, and it's very comparable to the high bid. So that's why we chose to keep it local and put that to be considered.
Can you, since we're talking about it, can you tell us just briefly about the UTV? Is that a new program?
So Reno County's never owned any UTV apparatus. The city of Hutchinson, previously they were the first ones in the area to start utilizing that piece of equipment. They recently have upgraded their units because they use them so much. They upgraded their units, and we found that in their use and from talking to their staff, that they're greatly needed. And we've actually had to call on the city of Hutch several times when we have issues with access along riverbanks, trees, where you can't get a regular pickup or heavy brush truck. My goal when I took this position was to get 3 or 4 UTV apparatus and spread them throughout the county. So I have them strategically placed, so not every district needs one, but we have one basically to help cover all the counties. And whether, like this one would be for Bueller, it would be available to respond to Southwest Reno County if that was the need. That's my goal. They have found they're not an initial attack apparatus. They're more of a come in, help mop up, overhaul, do some of that work, and access areas are big. We have issues with some access. So Sterling has one. They've had a lot of success with it. There's 1 or 2 in Harvey County that have been responded over here to help us in the past. So it's something that we've needed for a long time, and so that's my project, is to work towards getting several of these in the county to be utilized.
And I imagine Commissioner Bogner's had some experience with using UTVs and pasture burning and so forth. And what I thought was interesting, I hadn't thought about, was the fact that there's a holder on the tank for a drip can,
Correct.
Which for back burning is, you've got everything right there to control it right there on that UTV. I never thought about that.
So one of our tactics that when people think about the fire service and us suppressing fires is you put water on it to put it out. The way the terrain has changed and the tactics have changed, we fight fire with fire. It's a lot safer, and we have to plan ahead when we do it, but we do a lot of back burning to help ourselves and minimize risk and equipment and personnel safety. So these units will also be used for that, and they have a holder for a drip torch. So it's a new tactic that's been around for a while, but we use it quite often nowadays.
Any other questions?
Extra capacity for passengers in case you had to use it for rescue in remote areas where somebody couldn't get out.
The units we spec'd, they're just a single cab, so you could put 3 people in them. We considered a crew cab where you could haul 6, but the maneuverability of those in our use is not very well. you lose a lot of ground clearance, and it's a long wheelbase.
Right.
My experience with using one like that is they get hung up when you get into certain terrain, so that's why we didn't go that route.
Thank you, Travis. Unless there's other questions, we'll do roll call. Roll call, please.
Commissioner Hurst?
Yes.
Commissioner Parks?
Yes.
Commissioner Vogler?
Yes.
Commissioner Weitzel?
Yes.
Commissioner Friesen?
Yes. Motion passes 5-0. Okay, moving on to business items 8A. 8A's 2023 Annual Emergency Management Update. Adam Weishart is here.
Good morning, Commissioners. Adam Weiss, our Emergency Management Director. I gave you a lengthy update, and I'll kind of go through that, but I'm going to bounce around quite a bit, and feel free to stop me. I know you guys have a busy agenda here, so I'm just going to jump around on here. First thing I want to talk about is what we're responsible for. So we're responsible for the coordination of all components, essentially, in the emergency management system. So we're the county's direct liaison with any local, state, or federal assistance, including county partners. Also under our office is we do the fire administration for the county. So that's 8 rural fire districts covering 1,100 square miles of the county, which includes over 165 rural firemen, volunteer, on-paid firemen, on-call paid firemen, as well as 8 rural fire chiefs. That's that is 14 stations throughout the county. So the only areas for fire that we don't cover is South Hutch, City of Hutchinson, and District 2. Right now, we have a small office. We currently operate with a director, specialist, fire administrator, and then a administrative assistant. The 4 phases of emergency management are mitigation, preparedness, response, and recovery. So being such a small office, we often get stuck in the response and recovery portion of that wheel. It's constantly evolving, but we don't have a lot of time to spend on the actual mitigation and preparedness portion of our jobs because we're always out doing something. Recovery, we look at it like as soon as the event's over, we're immediately going to recover from it, and that's simply not the case in Reno County. We're dealing with that long-term care recovery for years on end. 2 and 3 years down the line, we're still dealing with recovery. Last week, my office had a really busy week. We responded to a lot of things, but in the background, there's the Cottonwood Complex where we're still recovering from that. Our volunteer organization's Active in Disaster has been really good. We sit on that board. They handle all our long-term care recovery stuff, and they're still walking hand in hand with the victims of the Cottonwood Complex. We meet with the victims next Monday, actually, to discuss what future steps are and what they're still going through. So coordination of resources, that's huge in what we do. So when we have a large event happen in the county, we're bringing in tons and tons of resources. For a normal EOC activation force for a large event, we have about 40 people that come in and help manage that event. It's anything from figuring out how to get people food and water at this point in time to getting our victims or potential victims evacuated from the scene to what's going to happen 12 hours from now, what's going to happen 24 hours from now, trying to project what's going to happen so we can be sure we have enough resources in there. For a large event, such as a fire, we generally have between 120 and 150 different pieces of fire apparatus. So every piece of apparatus that comes to us, they generally have 2 people on there. So if you think about the influx of people into the county, and when it goes days on end, we're bringing in somewhere between probably 750 to 1,000 people who don't live here to help with our events. So local disaster declaration, what does that do for us? A lot of times you'll ask me, when I come to the board, I'll ask you for a local disaster declaration, or I'll call the chairman of the board or have Randy call the chairman of the board and ask for a disaster declaration to be in place. And what that does is it tells the state that we have thrown all the resources we have at it. We've expended our contract, and now we need help from the state to get on state contracts, to get state assistance, to get federal assistance. What's that disaster declaration do for us? Not only does it cover us under tort liability, but it also qualifies us for reimbursement from the state and federal government. Our local threshold went up again this year. It goes up every year. It's $4.44 per capita, which means Reno County, and a large event is responsible for the first approximate $275,000. If we meet our threshold and the state meets their threshold, that means we can qualify for reimbursement through the federal government. The reimbursement comes at 75% for the federal government, and Reno County makes up that other 25%, making us at 100%. The recent disasters we've had from fires and floods and that sort of thing, the state's pitched in an extra 15%, meaning Reno County is only out of pocket 10%. And that local disaster declaration is what comes into play there. If we didn't have that local disaster declaration in place, we wouldn't qualify for any sort of reimbursement, and we could not use the state or federal resources. Recent things that we've received assistance from in the state, and just recent years, we received ventilators from for COVID. We received personal protective equipment, and then we've had a whole bunch of fire resources come in when we've had the large fires, including airplanes and Black Hawk helicopters. So we talked a little bit about what our EOC does and how many people we bring in there during these large events. And one of the problems we have in my office is our emergency operations center is not large enough. It's not adequate to run the type of large events we have. It's just there's some size constraints there. We just don't have the space to spread out that we need. So most of these large scale events are ran at the Hutchinson Fire Training Facility out on East 4th. It's absolutely wonderful that they allow us to come into their facility and run these events. However, we don't have the hardwired equipment in there. We don't have our radios. There's some real limitations out there. I invite every one of the commissioners out there when we have a large event. You can see what's going on. We might put you to work. Everyone's kind of working out there. I have one commissioner that's seen that firsthand.
Yeah.
Annual budgets. We're coming up on that season, and that's a big time for us. Not only do we do our budget, we also do the 8 rural fire districts. So there's time spent with every single fire district during this budget process, and it takes us a lot of time to do that. We're thankful to have Travis in the office this year so we can go out and meet with these chiefs one-on-one, and we can start standardizing equipment and standardizing processes through these rural fire districts so we can all do things the same way. Our CERT team, I always like to give a shout out to them. Our CERT team is our community emergency response team. It's just a group of volunteers, and they will answer their phone any time of day. They come out and volunteer their time. They help us feed responders, deliver items, do check-in, do staging areas, anything else. They volunteer their time, and they'll do anything we ask for them, so we really like that. So the major events I wanted to point out to you are the Albright Fire, which was February 8th, the Linksland Fire, February 14th, March 3rd, the Cottonwood Complex, and April 14th, the Haven Mainstream gas explosion. So in addition to what we do every day and all the other responses we've dealt with, these are the large events that we dealt with in 2022. Our fire season is starting later this year than what it did last year, but I fully expect to have some large wildfires this year. We do have some dry conditions. I think those will continue. And then some of the accomplishments I want to talk about here is our Cottonwood Complex fire. So Fire Management Assistant Grant is something that we've received twice since I've been here. One was during the Highlands Fire, and this is the second one. The Fire Management Assistant Grant is kind of a challenging grant to get because you have to apply for these while the fire is actively burning out of control and threatening a populated community. So as soon as we know it's starting to threaten our residents, I'm usually on the phone to the state and ultimately on a conference call with FEMA trying to justify our FMAG, our Fire Management Assistant Grant. What the Fire Management Assistant Grant is it lowers our threshold to $239,000, where if we meet that threshold, we can automatically qualify for reimbursement. The state's threshold also gets lowered from $5 million down to $718,000. And that's cumulative for any fires across the state for 2023. So the FMAG, while it's challenging to get on the front end, it lowers our threshold. It's a benefit to us, and it pays everyone who comes to the scene or reimburses our eligible expenses. Again, our GOAD's working with all those individuals that were part of the Cottonwood Complex. We touched on the fire administrator that we hired this year. That position's already paid dividends. about 2 weeks into that job. We're out at the Haven Mainstream gas explosions, and it's just started from there. He's been very busy, and we've really standardized a whole lot of stuff. He's put together some quarterly training for these fire districts, and ultimately, our public is going to have a better product from the fire districts because of this position. And then finally, we completed the emergency operation plan update. That's quite a lengthy plan. It's about 300 pages. Todd Strain, our emergency management specialist, spent hundreds of hours going through that document, making sure everything was in place. And we've actually changed planning standards or state planning standards twice since he started this process. So he's had to, this will be the third rewrite of the plan in the past approximately year and a half. So shout out to my staff, all credit to my staff. It's we're very thin. We don't have very many people, but I'll tell you, we're out all hours of the night. They're always willing to answer their phone and always willing to come out. So that's all I have for you this morning, but I'll stand for any questions.
Questions for Adam? Mr. Weitzel? No? Commissioner Hurst?
Oh, I think many of these I've gone to the command centers, and you've been there. You can probably cover it better than I can, but it's enlightening to just watch what's happening and stay out of the road and see how well they coordinate everything. Would you say that?
It's very impressive. Commissioner Parks, you have a Commissioner Bogner? No, Adam, thank you for your dedication and your team's dedication and your report today. It is always impressive to watch you guys in action. It's what do you got, 3 or 4 people there?
4 total.
4, yeah. So it's amazing what you guys can bring to bear in an emergency. I've seen hundreds of people come and literally minutes and hours to come help our county when it's needed, and I'm sure we help when other counties need as well, but it's pretty impressive what you do, so thank you for that. Couple questions for you. The gas plant, Haven Mainstream, what's the prognosis of that place? Is it?
So I know they're still doing security out there, but I can't tell you. We've heard it both ways, and one, they are rebuilding, and one, they're not rebuilding. So I'm not 100% sure what their plan is out there.
Is the current status of that plant something that the county should maybe keep an eye on as far as, it eventually becoming a danger to people or the environment?
If they rebuild, I think they're going to be fine because they're a gas plant. That's what they do every day. There's several gas plants across Reno County that's what they do, and they operate and they stay safe. If they choose not to rebuild, seeing the damage out there, I think there was enough useful equipment where they would probably strip the plant and it wouldn't be a danger to our community either way. So I think either way we're safe.
Is it something that we should ask about a plan, or is it not really a risk to the county at this point?
I don't think it's a risk to the county, but if you're thinking about what's the future if they're going to rebuild, that might be a question someone can ask them. We've reached out to them a couple times since this event, and it takes over a month for them to respond to us. So someone might have a better contact than what we have for it.
Would you consider maybe that would be something that Adam and Commission or whoever be in contact with the Chamber of Commerce to encourage their rebuild, maybe?
Yeah, I think that would be a good idea. I mean, would you like to do that? I would be happy
Open
to help.
mouth, insert foot. Is that what you're trying to tell me?
I'd be happy to help you.
Well, that'd be good if we can visit with Adam and get some more details and visit with the chamber.
Get a meeting with them and
Yeah.
encourage them to rebuild.
You're the chairman, so that'd be a good position.
All right. Can you work on that, Adam? I'm just Just delegated it, just like that. See? Thank you. And then for the fire season, I was, Randy, Administrator Randy, and I had talked a little bit about maybe scheduling a little bit of a joint report between you and Hutch Fire on just what you're seeing for this year's fire season. I'm wondering maybe we could even do that next week. Just a little report.
Yeah, we could add it to the agenda.
We've got 3 new commissioners, and they haven't had the benefit of going through some pretty big fire events and hearing a lot of feedback from you and the Hutch Fire Chief on the risks we have. So I think it might be good just to get them up to speed. Is that something we could do next week?
Yeah, the sooner the better on that one.
Yeah.
March is generally our busiest time of year.
Yeah.
So the more information we get out to the public, the better.
Okay. Well, let's plan on that, and we can use it as a bit of public information and get the commission up to speed on the latest threats. I know we're not where we want to be on risk mitigation, so an update on that would be great.
Absolutely.
Thanks again.
Thank you.
Okay. Item 8B is a proposed resolution from the County Health Department for the Advisory Board. Randy, you want to kick this off? Introduce, is Carla doing
Yeah,
it?
Carla Nichols, the health director, is here and had prepared this proposed resolution to change the structure of the advisory board.
Morning.
Good morning, Commissioner. Carla Nichols, Director of Public Health. So any questions on the resolution? I thought the resolution, we worked with Patrick on the resolution. So the purpose of this is to combine some advisory boards, and so our advisory board kind of represents the health department and everything that we do on a more well-rounded basis. So it would be the advisory board, the food policy advisory board would come into that, and that still fulfills the pathways grant that we do have. And then we also talked about representation on wastewater sections, and this also then takes care of that representation. So hopefully, any questions?
The only question I have is, do you feel that once a month is too much? I know you must feel it's correct, but I'm just wondering if
I do. I think there's enough going on in the community. I think just even having an update, more of our advisory board is, I like to have them updated on what's going on with the health department also. So they are aware of our monthly reports also and can ask us maybe some due diligence before we bring any projects to you guys. And we have their support also.
and the selection of the other 5 that's mentioned, you have 5 that's definitely on there, I believe, or is there 6? And then the others would be applications, or how would you handle filling the rest of the 10-member board?
So that is up to you guys, but when I was talking to Randy, what we could do is go back to your process. You guys do have a process. It is what we could do is have any board members currently interested, go ahead and apply, and any outside members. So it might be just a clean slate and then just a new application to make sure we represent all the facets that is covered on the membership request for this new advisory board. We can let it open for 90 days, or since we already have quite a few of those applications, do a 60 days, but it's up to you guys. We can follow the normal process. We would then take those members to our current advisory board for approval and then brought to you guys for final appointment. That is up to you guys on how you guys want to have this fulfilled.
I think you have 5 already that are knowledgeable, that the present advisory board's knowledgeable. You say you already have applicants. My suggestion would be open it up for 60 days and with you already have some that are knowledgeable that are on there that their term is not up yet.
We would probably have everybody, though, reapply,
Okay.
is what we would do, to make sure we have the
That'd be up to you.
the ad-
For
the
suggestion.
adequate recommendation. Sure.
I'm gonna go a little bit out of our normal order here and make a few comments. I'm a little worried that the size of 10 and bringing in all of the different kind of whatever you call it, modalities or whatever. You got a broad range of health care to child care to environmental health, wastewater. Are they, like the wastewater person, are they going to care about the child care issue? And is the child care issue person going to care about wastewater? And do you have a situation where it's, even though we have a wastewater person on there, nobody's going to care about it in the end, as an example?
Well, hopefully they do. What we would want to do is over time to help educate them also. Part of what we do for the advisory board is we do have different areas in the health department come to each meeting and kind of educate them on what they do. So hopefully part of that education, that continued education, that continues all members of the advisory board to be well-rounded of the different areas that we do represent in the health department.
And then, if I'm going to be, I would probably offer at least one amendment to this. I would appreciate the recommendations from the advisory board itself on new appointees, but I don't think it should funnel through them and then get filtered and then come to us. If we have a slate and there's preferential by the advisory board and seeing that would be fine. But I think I've seen it enough that there's some dangers associated with a board self-selecting new members. And so I probably wouldn't support that language in here today. But I wanted to throw those out so I didn't trip up anybody else in their comments. But Commissioner Weitzel, do you have some comments?
Yeah, well, I mean, they kind of echoed exactly. I wasn't sure why exactly we were combining them. Is it more of an administrative thing, or because I had the same concern that you had about, the food person. I mean, yeah, the other, I would imagine that the people now are on the different advisory boards are people that are, that's their area of concern, and so. I mean, I don't know. So I just had that question. Is it really wise to advise these? And then number 8, the vacancies being self-selected by the board. I thought that we should offer that amendment as well to make it so that any vacancies would go through the normal process.
And in Carla's defense, I think she was getting a little bit of pressure from me last year on, what are all of these committees needed? What is their purpose? And I think this was maybe one of the reasons this came back. I'm not saying this is the perfect solution, but I know there was some pressure to look
There was
at
a question, and full disclosure, I fully plan on voting it if we can change the vacancies thing. I just, I guess that was the thing was, my question was, is this the best solution, or is it from pressure elsewhere? Or, why exactly are we combining everything?
Recommendation from the board chairman. But it also it does take a moment to take a step back on the true representation of the health department and how we can make things better. So it is a good process improvement opportunity to fully represent all areas of the health department.
In a typical meeting, are you covering multiple facets of the health department with this board?
Yes, sir.
So it wouldn't be just one area, so that's...
All areas
all
are
areas. So
discussed.
is 10 required, or is
No, it was just
5
something
sufficient?
that, no, it was just,
I mean, I kind of echo their sentiments, but I was just thinking, I was feeling the same thing. You get too many people on board sometimes, it's,
yes, sir.
yeah, you know as well as I do how that can be.
Yes, sir.
So,
So we did, Commissioner Friesen, we did take the language from the current, and we can change that, but it says a vacancy that's occurring on the board shall be filled by nomination of the advisory board. They're just a nomination with appointment by the Board of County Commissioners. So that's the language. So it's a nomination, but the final appointment is from you guys.
Yeah, Commissioners, Carla asked me to work on the resolution, and I just took what was currently there. So number 8 was just what we currently had. It wasn't like something that was cooked up. We can amend it, of course. We probably should go through the process you guys put in place last year.
This is, typical. I'm 2 years in. We got 3 commissioners that are brand new. There's dozens of policies and hundreds of pages that we probably haven't read yet. So I don't think anybody's being critical. It's just now we are being, critical of the entire thing because it's before us again. So, Mr. Bogner, you have any?
I think I'd be willing to go with the present process, because as we talked earlier, if somebody's interested, now's the time to volunteer your time. And we've discussed that earlier in this meeting. And that's how this thing works. So if you've got something or some people you need, or you feel you need on that board, it's your chance right now. And there is a process to do that, for anyone to do that. So I'm okay with the process that's in place. But on the other hand, you need to take advantage of that process if you want somebody to represent you on that board, or several people. And as far as meeting instead of individual boards, I think you talk about wastewater, one way or another, we all have waste, no matter where you are in this county. Might be disposed of differently. We all have the same things. We eat the same foods. We do the same, food safety, that kind of thing. I don't see why it can't be a single board.
A couple ways we can do this. One is to wordsmith it live, or we could take, I think there's sufficient feedback, we could table it and bring it to March 7th and bring it for final approval. I'm personally okay either way. I'd probably lean towards getting it right and bringing it back in a week, but
I like the idea that you've combined those things together. One of my questions on looking at what another county does, and that was Sedgwick County, on how they structure theirs. And I think, being the size of our county and the involvement of the county, I think that having one committee who's knowledgeable about how they all function together and fit together makes sense, so that you're just not off on one tangent, another one. That's kind of the way I feel. As far as 8, question was on filling vacancies. I think they're nominating people, and they have looked at their resumes, and I'm sure they've got input from the health department as well when asked, and that I feel that that's worked satisfactory in the past. So to get things off of the board, we'll see where we're at. Why, I would move to approve proposed resolution 2023-05. There's a resolution establishing the Reno County Health Department Advisory Board. So we'll just start there.
Commissioner Hurst has moved to approve 2305 as presented. Is there a second?
I kind of like that idea also, that there be the terms are for 1 year, and they can only have 2 terms. So I think that helps solidify that thought.
Comment.
That it's not a,
Not till there's second. Second by Commissioner Bowden.
it's not a 10-year appointment. It's limited to get other people involved. And that's what I think is important, to get as many people that are interested to be involved.
Commissioner Hurst, Commissioner Bogner slipped in a second while you were talking.
Sorry about that,
That's
Commissioner.
okay.
Chairman, sorry about
That's
that.
okay. Commissioner Parks, do you have?
I assume this seeks to reduce a great amount of work for multiple meetings. Would that do that for you as well?
Yes, plus that, like.
I mean, you have enough commitments.
The collaboration is more than that. The collaboration is the end point.
Yeah, I understand that. But yeah, I could see where it would reduce a bunch of time too, maybe perhaps in meetings and stuff, which is a good thing. You guys are strung out enough, so, with your time.
Commissioner Weitzel?
Would it be appropriate to offer a motion to change number 8, the vacancies?
Yeah, you could absolutely do that.
Let's see, I would.
I would suggest if there's a majority that wanted to just table it and take it up. I forget the procedure to kind of straw poll, but you can do it either way. I mean, you can do it that way, or we can have staff bring it back next week. I mean, would you be okay with that, Commissioner Hurst, if we had staff bring it back?
Well, I would be okay, but I caution the commission that just when things are brought up, I think there's time enough to handle those things ahead of time, and that we keep putting things off. Pretty soon we've got 10 items to work on that we've already had opportunities to review. So that would be my caution on that, is that we keep putting things off and putting things off. Well, pretty soon we've got 20 items on the next meeting.
Well, this is one, and it's a small change, and I prefer to get it right than to not. But there's a motion on the table. Any other discussion? Commissioner Weitzel, you can offer your amendment if you want.
Yeah, I don't think I can do a motion table at this point, can I? With there being a motion?
I don't think so.
No, because you have a motion on the table. I would offer for discussion as I thought about this, and whichever way you guys go with it, the trick with this particular board will be that when we have a member of a certain contingency going off the board, we will want to try and replace them with someone from that same community, which we can do through the nomination process or through the normal applicant process. But just keep in mind, if we have someone who's there representing the sanitation area contractors, we'll want to try and replace them with a different person from that community. So that will kind of complicate, which I can write it either way, or you guys can make an amendment. But just keep in mind as we go through this, there is kind of a theory of why some guidance from the advisory board might be helpful to the commissioners. But you guys will still have approval.
So why would you have geographic requirements for kind of subject matter experts?
I thought we got.
Is that what you said?
No, not geographic
Like
requirements,
area,
except for the people
Like
who.
area like childcare, like,
Yeah.
or
Okay.
let's say that somebody represents
Geographic.
mental health. We want to make sure we replace them with somebody else that represents another top health concern like mental health.
That makes
Yeah.
It
sense.
has to have those representatives as a member of the board.
Let me try to get this off dead center. Or Commissioner Parks or Commissioner Bogner, do either one of you want to wait till next week?
I mean, I can see both sides of it personally, but the other side of it is with final oversight. I don't know that it's a terrible issue. I just to have to wait for.
I think the thing is, when there's a vacancy, do they come to the board with, hey, this is the person we'd like to fill it, or is there the normal application process, and then the Board of Commissioners looks at all of the applicants?
I think that's in there, correct?
Correct. We have to follow the normal process that you have. And so we would have a recommendation, but you would have all of those applications. Yes, you would see all of them. And then you would have the recommendation from the board on why that's a recommendation. And hopefully that would support the area that they're representing. But yes, you would have then final approval in all of those applications.
Okay, so but does the final approval only from the nomination, or could the final approval come from any of the people? Because the way I read it, it should be filled by nomination, the advisory board with appointment. So the way I read that is the nomination would be the person we can vote on, but not the others. Is that correct?
That's not the way I had read it.
Okay.
No, that's not.
I think you'll be presented a nomination.
No.
Yeah, they just have the job of usually when you're on an advisory board, when it's your turn to go off, the polite thing to do is try and suggest a replacement. I think that's all that's contemplated here, really.
Okay, well, I don't have a problem with that then.
Correct.
Okay. I was thinking one other time in past commission meetings, we had that too, that there was a couple of nominations or three that then we ended up making a final decision on, and I can't remember what it was, but I believe that's the way we've handled that before.
Well, I prefer a couple wordsmithing items on it, but I think I'm in the minority. So, and to your point, we could, have done more work ahead of time on this, but I thought it was appropriate to do the work here.
I understand what you're saying.
And also, I only get this the same time the public gets it, so, having a weekend to review, 156 pages is a lot, so.
It is.
Okay, feels like there's enough discussion. We'll do roll call, please.
Okay. Commissioner Hurst?
Yes.
Commissioner Parks?
Yes.
Commissioner Bogner?
Yes.
Commissioner Watzel?
No.
Commissioner Friesen?
No. Motion passes 3-2.
Commissioner Friesen, I have a
Yeah.
question. On the typical application process, it does state a 90-day. Are you okay if we edit that to 60 days since this is already an existing board, or would you like us to stay the 90-day?
Well, I can't, now that it's approved, tell you what you can edit, but,
Okay.
because I'd have a few edits too.
Then we will stay
That's
that.
the administrative procedure, not part of this resolution.
But we can, yeah, if it's administrative, then it's fine. I generally support what you do here. I just had a couple clarifications. That's the only reason I voted no, so. Item 8C, you're up again.
Sure. So this is for the Health Department to apply for a comprehensive opioid stimulant and substance use site-based program, which is COSSIP, grant application for $1 million. This would be $1 million grant that we would receive over 3 years. This is not for additional staffing, so just to kind of put that at ease. This is to continue the work that we are already doing in the community. And I will have Seth Dewey, our substance misuse health educator, come up and provide you with more information and or answer any questions.
Hello, everyone. Thanks for letting me talk on this. So what we're going to be trying to do is just focus on some of the other areas that we've already done. As you already know, we've developed the overdose dashboard that's helped us monitor our overdoses here in Reno County. That's allowed us to better track our prevention efforts and things like that. But one of the things that we've wanted to work more specifically on is reducing our recidivism in the county jail. And as we know, when we talk to our law enforcement partners, the jail has had extremely high numbers recently, and a lot of that has to do with the substance use issues. And so that's one of the issues we want to try to address by adding more treatment options in the facility. And that's one of the things that we wanted to focus on is the treatment options there. The other thing we want to work on is our overdose fatality review board, which we've started the process of that. And that's going to be working with our district attorney and also our mental health and substance use providers here in the community. So that's the high-level approach to that. And like I said, like she said, it's over the course of 3 years to continue the work that we've already been doing. Any questions?
Questions for Seth? Commissioner Hurst?
Drug court involved in this, or is this beyond that?
Some of the staff will be involved in making those recommendations on the Overdose Fatality Review Board because we know that corrections and drug court have lost clients, of course, to overdoses. And what we want to do is try to go further upstream in our prevention efforts. So what we do is we gather everyone together at the table and we look at times where individuals have had points of intervention, right? Not to point fingers at one another, but to see where we could make those interventions and go further upstream. And so this is a way for us to come together as a community, go further upstream, and make those recommendations to see where we can make improvements.
We entered in a collaboration with the city of Hutchinson on a substance abuse area. I forget how many it can hold in that, but could you update on that? Do you know that much about it, or the what do I want to say? Where they've got a housing program there to handle the real tough substance abuse. Is that what what's the name of that anyway?
Oh, the treatment facility?
Yeah.
Yeah, that treatment facility is staying full. And the nice thing about that is we've taken a lot of the individuals that were going to the jail and having to detox there. They now have that social detox setting there at that SAC facility. So a lot of times those individuals go to detox there and then can continue their 28-day treatment facility there. So what this will do by adding the treatment facility or the treatment programs in the jail is hopefully add more of those wraparound services so we can get individuals treatment in the jail, started on that treatment, and then when we get them out, they can have those wraparound services and continue that care instead of going to jail, they get out, and there's that gap, right? So we want to make that whole continuum of care where there's a warm handoff and continue that.
I know this is a continuing program and going into the jail. How is that going to work with Mr. Hill that works with him currently down there?
That's who we're going to be working in close contact with on that program because Mr. Hill, he already has a lot of those excellent peer services programs. We have 12-step programs that are going in there. What this program is going to do is hopefully get into some of the medications, especially with the advent of the powerful opioids like fentanyl, right? So that is changing the shape of how we treat, particularly opioid use disorder. It's causing us to get more innovative, and hopefully this is going to be the thing that reduces that recidivism, reduces overdoses in our community. And right now we're already on track. We're one of the few counties that has a reduction in overdose fatalities, and we want to continue that track.
So without additional help, is he going to be able to handle doing this through this program? You're talking about going further upstream and adding more things that you're looking at. It's more work, obviously. I guess my question is, it sounds like more help's going to be needed.
Well, hopefully what we're going to be able to do is utilize the mental health providers that they also have there at the jail already and work with probably Horizons, who's working there at the jail.
Right. How far upstream?
Well, hopefully, through the course of overdose fatality review and at the jail, we can make those recommendations to other community partners to hopefully go further upstream to in the schools and things like that.
Well, that's what I mean. Children's where you got to find them. You got to find jail. They've made their decision already a long time ago. A lot of them are repetitive in and out. I get that, but if we don't reach for the children in most of these programs, you felt my heart here before about how we have some children that get tossed out of homes that are currently not being cared for as well as they should. That's where they need to be reached.
So by looking at
every bad thing, if you look in society, I'm obviously not a psychologist, but every bad thing that you see that's going on, from
governments or whatever that comes down. It's targeting children all the time, targeting their hearts, their minds, and going after them. And we got to do more intervention in that area. And that would be my heart, is to get after them more than I would the ones that are already addicts.
Well, and hopefully by getting in more contact and making those face-to-face interventions with those individuals, we'll be able to find out what specifically in our community, though, we can do to touch those individuals and make those particular specific interventions here in Reno County to get into that those particular individuals.
I appreciate that. Thank you.
Anything else?
Mr. Bogner?
Sounds like he's covered it pretty close.
Seth, thank you. I agree with your work here. Sometimes I get a little worried about grant programs and what they actually do to our scope and overhead and so forth. But this seems like we went through a strategic planning session with the health department in November, and I think one of the commission's comments was, hey, we need to focus on a few things that are most important. We got a lot, we had a whole buffet of things that we were working on, and it seemed like this was one of the top issues. So certainly support the grant. A couple questions for you. How are you measuring success in this program?
So for this one, it's going to be working predominantly with the jail, hopefully measuring that recidivism. How many of those individuals continue to come back, the length of time before they come back, and things like that. And then as far as the overdose fatality review is going to be based off of our recommendations that come out of that overdose fatality review. Some of the previous recommendations that have come out of successful programs, for instance, on the East Coast, have been implementing counselors and peer services, for instance, in the hospital setting for individuals that have non-fatal overdoses in the hospital, right? Instead of just releasing those individuals, having an individual to connect them to services right away. That's just a small example. But there's other points of intervention that could be had.
Is it something you could develop and report? Carla sends, was it twice every 2 months or monthly? Like we could just add that, as you develop a tracking protocol for whatever goals you have.
We report on those.
Yeah, and maybe I just missed them in the report already.
No, hopefully after we get this grant, and that would be a good thing, then it will be added. But usually in all of your monthly reports is specifically why I outline the different areas is like, especially when it comes to the health ed, you'll have different initials and I outline. So you have an update every month on what we're doing on every grant, like RROE, OD2A, CDRR. That's part of that monthly report. So you have a monthly report on what we're doing with those grants.
Well, like the narrative's great. Like a little quantifiable metrics where we can, look at a graph and see, your work producing results would be wonderful. And I know sometimes you're trying as hard as you can, and it's really hard to change the course. But just tracking it so we have something to measure by would be very helpful. Commissioner Hurst has
Commissioner Parks brought up something that I've just been thinking about here. And this is reactive. And I think you brought up a very good point that we need to be proactive, and that hopefully some of these funds can be utilized through people that have recovered, can go out and be able to bring that message to junior high and high. I would hope that there might be a way that could be done with that. That would help a lot, wouldn't it?
I think so, yeah.
And that was kind of part of my comments was the complexity of this problem and the amount of agencies and people working on it is fairly extreme. And so, you can have an idea like that, and then, there's 10 other people working on some facet or idea like that. And so I think focusing on what you think is most important would be good, and making sure like, I don't, so the Stepping Up Council,
Yeah.
do you go to that usually?
I do.
You have to, you gotta go to that, because that's where everybody, okay, you're invited. So, like, that's where everybody is talking about this issue on a county-wide scale, and my frustration with that meeting is everybody's always talking about what we need to do, and there's definitely people trying to make progress, but progress has been very slow in the overall effort to reduce recidivism, or you need to say something. I can tell you want to say something. Go ahead.
Well, about the youth thing, you know, we have Rise Up Reno, who does amazing work here in Reno County. Also, we have a flyer that just came out yesterday, so I'll be getting that out to you. On August 31st at the Fox Theater, we have an event coming up called Change My Mind. We're going to be showing a movie called The First Day. It's the story of an NBA basketball player who now does youth prevention work. He was an NBA basketball player who developed a substance use disorder, but now does work with youth. And then we're going to have 4 panelists from here in Reno County, one in Sedgwick, who are going to also do question and answer and talk about their story. So it's going to be directly targeted towards youth and individuals that we can specifically target here in Reno County. So,
well, you know, I think I was trying to formulate where I was going with that, but to me, what it feels like is there so many people that care about this issue and so many people are working on it, yet there's still a little bit of lack of, you know, who's coordinating, like, all of this together and making sure we're not duplicating efforts. And, you know, Commissioner Hertz wants you to do this, and, you know, that sounds kind of like the old DARE program, which I know we have a new program or something, but, like, how is this all being coordinated together?
So there's the Reno Recovery Collaborative that has 3 subcommittees that are targeting on our strategic plan that has been developed. I know Randy Henderson and the Health Department has been taking on this work since 2015. It was the Drug Impact Task Force back then. Some of you might have been involved in it. And they've been bringing in the medically assisted treatment. That's where the detox facility spawned from, things like that. They meet once a month.
What did you call it?
It's the Reno Recovery Collaborative. We meet at Doctors Park on the 3rd Tuesday.
So, like, number one, this is not critical of all of your work. I think it's just like we're trying to understand it, and like this problem's massive and it's complicated. But it's just interesting, like you mentioned, like the big collaborative piece is the Reno County Collaborative, and I knew nothing about that. And then I mentioned the Stepping Up Council, and you knew nothing about that. And it's, well, you were invited, right? And so the organization, I think between all of the efforts, you know, we could do even more. I don't know if that's your problem, but it's an observation, I suppose. But thank you for doing your part.
The biggest room in the world is the room for improvement.
Yeah.
We can all do better. But thank you guys for letting me talk on this issue.
Is there a motion to approve the grant as proposed? I'll make that motion. Is there a second? Second by Commissioner Bogner. Any final discussion?
Thank you for your efforts.
Yeah.
Appreciate it.
It's hard work. Hearing none, roll call, please.
Commissioner Hurst.
Yes.
Commissioner Parks.
Yes.
Commissioner Bogner.
Yes.
Commissioner Wetzel.
Yes.
Sorry, Commissioner Friesen.
Yes. Motion passes 5-0. Carla, was there anything else you guys wanted to say on that? I noticed there was a bit of glancing back and forth between staff members.
I was having him invite you to that harm reduction event that we have coming up on March 31st. So that's what he did. So.
Okay. No problem. One more.
Two more.
Two more.
Two more. One for all. Two more.
You got two more?
D&E.
I got a split agenda here. It's between two pages. Sorry.
So, this is a continuation of what we do now. So this is a continuation of our Kansas Department of Health and Environment Healthy Families Agreement. This is a grant that is 100% pass-through. It must land with a governmental administrative agency, which is the Health Department. We do get 2% of this grant for our accounting time, for Bethany's time to then do all of the accounting for this budget, for this grant. It goes to the Kansas Children's Service League for our maternal child health and prenatal services for teenagers. And then the the Hutchinson Community Foundation does provide the match for this grant. So it's a continuation of what we're doing now, and so that is what we're bringing to you for approval. For the approval of to sign the letter and the agreement that is provided.
Questions on 8D? Commissioner Hurst? Commissioner Weitzel, when you're ready.
I move to approve Reno County Health Department's continuation of the Kansas Department of Health and Environment Healthy Families Agreement for $320,000.
Motion by Commissioner Hurst. Is there a second?
I'll second.
Second by Commissioner Parks. We'll take a moment. I think Commissioner Weitzel has a question. He's just preparing one.
Yeah, so I could not find anything about this online. I mean, it sounds like we got a motion in a second, but I would really like more information on this. Like, the only thing that came up online when I searched for it, anywhere including the Kansas Health Department website, was some minutes in a Riley County meeting. Like, that was literally the only thing I could find out online. So I would like more information on it before we vote on it, but especially since it's costing, $160,000 in county money, but.
It doesn't.
Is it?
Not from the county, it's a match from the Community Foundation.
Oh, okay.
Yes.
Okay.
Yes.
This actually doesn't cost the county any money except for my time. It's a completely 100% pass-through. State of Kansas takes half of it. Hutchinson Community Foundation takes the other half. So it's actually, other than paying for my time, the county is not charged for this, and we actually are reimbursed that 2% pass-through for it. So this is actually a continuation program reaching, its focus is children between the ages of 0 up to age 5, with the primary focus of 0 through 3, with a heart towards teenage pregnancies, although it could be any families of that. So there's your focus on your young people getting it started. But this actually doesn't cost the county anything except my time.
Okay, can you give me some information on this program? Like, email it to me, because like I said, I literally could find nothing on
Sure,
it.
we can do that. We can do that.
So,
Sure.
Another discussion?
So, and my no vote on this will just be because I couldn't find any information. So,
Is there a deadline?
Yes, March 15th.
March 15th?
Do you want to wait?
Will the 7th meeting, if we moved it to there, so Mr. Weitzel could look at that information, will that throw you behind? To where you wouldn't have adequate time to
Basically,
submit?
what I would be providing him is a brochure for the Kansas Service League of their services that they provide. So I think the lack of information was just a lack of knowledge on where to actually look for it.
which is very possible, yeah.
And we can get that one.
So basically, if we would decide to put this off for a week, that makes it hard to get the grant application in. I think
It would still be okay. I mean,
That's kinda
it's
what
not
I wondered, would it
ideal, it's
be-
not ideal, but we can do that. I mean, because if we have your signature on the 7th, then we can get that into the state. we'll try to be as accommodating as we can. So yes, it could work.
I think there's a lot of these grants that the health department depends upon to have so that it doesn't cost the Reno County citizens direct money. It costs us money because it's a federal program or a state program. It costs us money there, but it doesn't cost us a thing directly that this county is having to pay the whole amount to get the same amount of good results from this. And I think that things, and I don't know where this all fits in, but the WIC programs and the SNAP programs and so forth are vital to especially those who are low income and have some family situations. So that's why I don't have any, just being around it long enough, okay?
Yeah. I mean, it might be a great program. Like I said, I just couldn't find anything on it anywhere, and so.
Are you good with the motion as is?
I don't think you're new.
I guess that's, yes. Are you thinking?
No.
Okay. Roll call,
my
please.
moments, I don't think.
That's okay.
We all do.
I thought you were contemplating some. Roll call, please.
Ready?
This time.
Commissioner Hurst,
Yes.
Commissioner Parks,
Yes.
Commissioner Bogner,
Yes.
Commissioner Weitzel, Commissioner Friesen.
Yes. Motion passes 4-0. One more?
Thank you. Yes, sir. One more. So every year we do have our aid to local funding. So this is state funding for a lot of our different programs in the health department. You were given a summary of all of those, just a program purpose of all of those different areas. So this is the application that we make to the state, and hopefully we get full funding. So that's what we are after. Bethany does do a full accounting of for our child care licensing program for the amount of $210,816. Our chronic disease risk reduction program for $92,500. Our family planning program for $126,058. Our immunization action plan for $22,995. Our maternal child health program for $292,044. Our public health emergency preparedness program for $63,959.40, and our state formula. The state formula is the formula that is, this is a kind of a base amount that's given to all health departments in the state of Kansas. So we maximize that base and request for all the money that we can. So this amount, this grant application, of course, that is also due, it's due March 15th, but we try to bring it to you earlier for a total of $890,420.40.
Questions? Motion?
Yeah, I've got some questions. So the immunization action plan, what vaccines can that be used for?
So, so that is for any and all, but we do have it, that program is basically for those on state insurance or underinsured or have no insurance. So it's access to all of the all of the programs, all of the vaccines that we do have at the health department that is provided free to the state by us.
Okay, yeah, because see, when I looked up the program, it said it could only be used to purchase COVID vaccines.
Oh, no.
That's what I got.
No, it's for.
This is what I pulled right off the state health department website.
That's funny, so.
That's a supplemental. That's a
Okay.
supplemental, so that's different than the
Okay.
IAP. The IAP covers the VFC program, which is the Vaccine for Children program that was enacted, and that allows access to all those that Carla had talked about.
Okay, yeah, because when I clicked on the program online, this was the only thing that came up. Was this right?
Yeah, that's supplemental.
Okay. And then I did have a question, and he said it would be better to direct this to you guys. Are we allowed to, as a county board, limit things that these grants are used for, as far as like for example, the family planning grants? One of the things that the money can be used for is to sterilize people. I imagine we would not be doing that in Reno County.
Not at the health department.
Yeah,
Not at
but-
the health department. It's services that we provide at the health department.
Right. And so, but like, is that something we can say, hey, you know, we can approve this money as long as it's not used to sterilize people or things like that? I mean, is that something we are allowed to do? Because like I said, I imagine it's something that we're not doing, so I think putting that limitation on there would make me feel better.
So the family planning grant, there are limitations that can be placed upon it. They cannot be placed by a county organization. The state has placed some limitations on that, which are things that we have observed and that we do observe. However, a lot of the information that has been supplied about the family planning grant is not necessarily accurate nor valid information as per the grant guidelines. There's an entire website of grant guidelines for the family planning, and sterilization is not something the health department actually does, nor is it supplied by the family planning grant. We are actually able to create a work plan on what we're able to create or do through that service within the mandates provided by both the state and the federal grant itself.
Okay. And then on the maternal, child, and health, do we use the one key question? Okay, so I looked into that a little bit, and so one of the resources provided by the one key question is access to abortion. That's on the bedsider.com website. It's right over on the right side, abortion, how to get one, where do you go, how do you pay for it. And then on the same on the powertodecide.org, 457, it talks about that. And so, if we're approving money to help people figure out how to get an abortion, I'm not okay with that.
Go ahead, Karen.
So the one key question is really about the reproductive life cycle. We can utilize that how we want to. We are not proponents for abortion. That's not something our mid-level wants to do. We do what we are required by law. So they may give them a phone number. We don't have recommendations, and we don't do referrals for abortion.
But do we provide them information like, for example, hey, here's, you can go to bedsider.com. Is that like within our things that like, because the one key question thing, like right on
The purpose of the one key question is to look at pregnancy. What's your intention for pregnancy? Do you want to get pregnant in the next year? Do you not want to get pregnant in the next year? Are you pregnant? Those types of things. And so then that goes with the reproductive life cycle so that we can do education. So if you're not wanting to get pregnant, we would then say, okay, then here are different ways to not become pregnant. If you are wanting to become pregnant, then here's how you can have a healthy body. So it talks about those things. And if you haven't thought about it, which some people do not think about it, then let's think about it. You want birth spacing. And so it's a lot of education with that. Our providers are not for abortion. So
okay.
That's a good question.
So, but did we provide people with information with links to sites where they can figure out where to get an abortion?
We don't provide with links. I think what is required is that you'd offer them a phone number, but we don't make any referrals. That's on them to do that.
If you don't mind, Mr. Wetzel, you weren't in the meeting in November that we sat in before we were sworn in with the planning, Carla, that we were there. And not to try to buffer what you're doing here, but I do remember you taking the position in that meeting. I don't want to speak out of turn here, but the position in that meeting that you don't try to make referrals for that. But on the other side of that, if you don't mind me asking, if you're going to provide a phone number for that, do you provide phone numbers or information for the other side of it for continued help, like pregnancy crisis centers and things like that as well, if they want to further go somewhere else and not with your agency? I mean, they can get the care, it sounds like there, that you can follow up with them, but I mean, there's other, if we're going to offer numbers, and would we offer a number to somewhere down the street here that does excellent work as well?
I'm a little confused as to what you're...
Well, his question was, do you offer information to send them? And I think John's...
We do everything we can to have a healthy pregnancy. everything.
That's what I understood from our meeting in November, that you're on the side of trying to save and rescue and have healthy full-term pregnancies.
Absolutely.
Yeah, and so but we do have other resources. Do you refer to those at times if you need to, or do you feel like you can handle all that in-house?
Yeah, I mean, if we can get somebody to have a sonogram and to speak to people, I mean, we'll do anything we can. And we have lots of resources within the community that we work with.
I don't know if that helped or not, but.
No, I think these are important and reasonable questions. We're getting a little out of scope of the agenda item. I would suggest, I think we've delved into a broader discussion of, what is the oversight authority of the health board, and, what are policies that the health department are implementing versus statutes. And, what I might suggest, and we're going to talk about this later on our planning calendar, we have April 11th on the docket for the health department strategic discussion. I think we could ask Patrick to work with the health department on, what's statutorily required, what's under the oversight of the health board, et cetera.
I wrote that down when we started to figure out what to answer this.
And so that might give
Yeah,
board some more guidance.
And so when I was reviewing this, what I was looking at, okay, well, what if I was, and I, despite what you hear, I don't think I can get pregnant. But I was like, okay, if I am pregnant, what are the resources? If I, and I said, well, what if I want abortion? What are the resources? And then I was like, oh man, there's a lot here. Just provided by the links and different things from what was available on the KDHE website. And the big thing was the one key question. A lot of it funneled through that. And so...
Commissioner Weitzel, I'd recommend, this sounds like something you're passionate about, and I appreciate that. If you could put into writing maybe bullet points of your concerns, we can get that to the administration. They can run through and give us some early input, and then we can put it on the docket for April 11th. Does that sound good? Okay. Did we have a motion and a second on this?
Not yet.
Okay. Is there a motion?
I'll move to approve the Reno County Health Department's aid to local grant application for $890,420.40 in lieu of our timid commissioners.
Hurst begrudgingly moves.
No. Don't put it that way.
Is there a second?
I'd second.
Second by Commissioner Bogner. I feel like we've discussed this fully. With that being said, roll call, please.
Commissioner Hurst?
Yes.
Commissioner Parks?
Yes.
Commissioner Bogner?
Yes.
Commissioner Weitzel?
Yeah.
Commissioner Friesen?
Yes, motion passes 4-1. Thank you. Thanks for doing it all in one big slug.
Now the room
Patience with a bunch of slugs, one or the other.
A bit of both. Minister Partington.
Okay. On the, I have in my report the monthly department reports from Human Resources, IT, Maintenance, Public Works, Solid Waste, Treasurer, and Youth Services. These are the monthly reports you receive each meeting, so different departments, any questions on any of those reports? Okay. The other items I wanted to mention is at a previous meeting, I believe in January, or maybe it was February, but the commission appointed Commissioner Hurst and Commissioner Bogner to meet with Harlan and myself to talk about the courthouse renovation project. We've had a couple meetings, made some changes, and we had our final meeting, I guess, follow up this morning before this commission meeting. And the original project total was 2.187 million. With the changes recommended and made by the two commissioners, they cut $319,975, bringing the total to $1,867,025. This does not include the furnishings, but we do have money in the reserve to cover this amount. The intent was to see if we can get a contract prepared to be approved at the next meeting next week, because otherwise we would have to wait till March 28th. This is about 3 months from the bid proposal. The local contractor, we're hoping he's still able to work with us, but the longer we wait, the harder it's going to be for him to be able to honor this project, because he has other work he's probably having to do, and subcontractors the same thing. The cuts that were made were the dumbwaiter of $61,000 was removed, the walkway of $292,000 was removed and substituted with a platform lift that will be on the stairway to the mezzanine. That will be about $60,000. So still cut about $231,000 there. And then the second floor Southwest Conference Room and office, that's where legal services is now. They're going to move to the fourth floor. We've removed the $27,000 from that item, and staff can do that in-house because it's really carpet and painting of walls. So those are the changes that have been proposed by your two commissioners. Wanted to see if there are any questions or concerns before getting a contract to have in front of you next week.
Questions? We appreciate all the hard work by the committee. And I do think it's imperative we get a contract next week. I know the DA's been patiently waiting for a long time.
Right. Okay. The other item I have, and I kind of mentioned it in my weekly report to you, last year we brought in professional development for 36 department directors, supervisors, different levels of management, and partnered with the University of Kansas Public Management Center, brought in some trainers for a 3-day training. In meeting with directors at our leadership meetings, the consensus there was we would like to do that again this year and train a different group of 30 people. So it's within my spending authority because it is under $20,000 and we have budget money, but I wanted to bring in front of you, especially the 3 new commissioners. I think you haven't been a part of this or seen this. This is bringing former county manager, former county counselor to town, and a 3-day training to get people to kind of learn a different culture, the culture we want here at Reno County, about higher performance organization, what it takes to get everyone involved, everyone engaged at all levels of the organization. I think since we started this a year and a half ago, there has been a culture change, a slow movement of culture change at the organization, and I think this will be continued if we can bring them back this year. We bring them back in June. We would have the training at the community college, the student union, and then the intent is to have a train the trainer in addition to that, so that in the future we don't have to keep bringing them back. We have 5 or 6 or 10 people here at the county that can do the same training in different modules so that we can save money in the future. Any concerns with me moving forward with this? And if you want information, just email me and I'll send you more information about higher performance organizations and the proposal.
Yeah, I'd like that organization or information.
Okay, I'll get that to you, Commissioner.
I appreciate your work on it. I think government agencies especially don't always work on culture much, so I appreciate your work on that. And it sounded, from what you've told me in the past, that staff is appreciative and more engaged and motivated with this work, so it's good. Okay, thank you. County Commission reports. Commissioner Bogner, you have anything?
I intend to speak with emergency preparedness. I've been getting a few phone calls on this new fire regulations. I kind of expected anytime you make a change, you're going to hear some things, but various people have been calling, been disappointed in being able to burn when they feel they need to. And I know we're all new in this. It's just passed. I just kind of want to check into a few things. But yeah, people are a little disappointed at this point. I know there was some problems with the internet part of it. From what I read, they've taken a step forward and gotten a lot of correction there, and they've changed their format a little bit, and they're still tweaking things so that, but it's just, people felt that 72 hours sometimes is kind of long, and people have thought that there's a lot other than wind that should dictate. I mean, I know you can't have a big wind, but as one guy pointed out, he said, I'd like to burn. My burn location was on a work field. Maybe there could be some considerations in allowing a burn to happen by possibly even bringing up on the internet, you can get a look at the maps and see what's presently there. If there's no danger, there's no danger. Maybe integrating something like that, but I'm just telling you, I've been getting phone calls, so it may take a little looking into.
Well, yeah, I think we would appreciate the feedback that you get, and you know, I know we haven't done a lot of this, but if you're welcome if you have some suggestions to make the resolution better, you know, to work with Randy and Patrick and bring those back to the commission for consideration.
I'd like to talk to those guys and see what they feel would be appropriate and what they think is doable. I know when you start making it, that's the hardest thing when you've got a hard set of rules. Well, if you start making deviations, and then it's why did you do it for him but not me, and you run into a whole mess of stuff there too. But like I said, it was suggested to me. I will ask and see what the general consensus is with the guys that's got to handle the problem.
Anything else? Any comments on that?
Well, pasture burning rules, I don't believe have changed at all. It's just the brush piles, and yeah, I kind of agree that if you got out in the center of a 40-acre field that's wheat, maybe not wheat stubble, but wheat newly planted work ground, that maybe they could take a visit and okay it.
Well, I think you guys are welcome to suggest revisions. We'll get them back on the agenda. Makes sense. Anything else, Commissioner Bogner? Commissioner Parks?
Can I say something about that too? I have somebody in the fire department out in Nickerson made that comment, and I think Randy and I talked about that too, that there's a lot of people in the fringe that don't even know this exists, and there's no way to reach them. They don't use the devices we carry around in our hand. They're not using the internet, and so an education to them, and they had suggested mailers to everybody. We can't do that. I mean, for the cost, it'd be cost prohibitive, but I think you're working on ways to try to get that out, you said. So, right. And that was one real concern, because there is a certain sect still that doesn't use this kind of technology to find it. So, and so that I'm glad to hear we're trying to reach out to them, because he had a concern about that as well.
I'm glad you brought that up, because they did make a point that or working on the education part of it.
Yeah.
In education also, I found out it's to include the volunteer fire department people too.
Yeah.
Because they were giving some wrong instructions to one individual.
Yes, they were. Yeah.
Weren't they? You got a call too, huh?
Yeah, I did. Yeah.
Very good.
I'm going to meet with Darren Campbell to visit with him a little bit about some things that we'd previously discussed in a meeting, just for clarification for him more than anything. I think where I stand on some things, and so in moving forward with the shooting range out there, and so I certainly fully support his efforts out there. And I didn't really have a whole lot else other than I became an actor last night because I got forced into it. I went to a dinner theater and ended up losing my job during the dinner theater from an HR manager to a janitor in a basement closet. And so, and if you want to know, my name was Dusty Mop. I'll just leave it at that. Okay. It was a lot of fun.
Where'd you do that?
Out at the airport steakhouse.
Commissioner Hurst?
Yeah, one thing, because we didn't have a meeting, but we have those meetings not every week now, is last week, I think we'll give a shout out that it was National FFA Week last week, because they do such a great job in training leaderships and opportunities for our youth. And I think that was great. Randy, I gave you a copy of a request that SCED has with regarding would like some help with sending in a letter for their support of doing a grant for the 13 counties that SCED is involved with on entrepreneur training. And I know Reno County is very strong in that. Jackson was at the meeting, and so if you want to say anything about that, but I think he's going to be an integral part in making sure it's done right if we get that grant. You want to?
No, sure.
Since you're here?
Since I'm here.
If you're here, we're going to use you.
And I didn't plan to speak today when I'm here. I'm still in the outside coat, I realize, so apologies for that. But yes, very excited about that grant from SCED. You know, as you all know, and I think I'll be talking to some of the new commissioners about this when I can. And on a brief personal aside, I'm just coming on the end of some paternity leave, having had my first child. So that's kind of what's been going on in my personal life. But very excited about that through SCED. We already do a lot here in Reno County around entrepreneurs. We have a great partnership in that. But SCED is one of the partners in our Reno County Entrepreneurship Ecosystem Partnership. Big mouthful. And I look forward to working with them on doing that. And that may even include me taking a little bit of my time to go help out in some other counties around in that district to help them provide some services to entrepreneurs as well. So, thank you for the opportunity to share. Anytime I can get up in front of you all and talk about the good work that Startup Hutch does and the great work that SCED does, happy to do it.
Thanks, Jackson. Congratulations.
K96 and Quad County meetings are coming up here Friday and Monday. And just let Randy know if they're going to be here, well, we can, all the commission members can attend any of these meetings. Randy, you want to cover that?
Yes. You can have a majority as long as we notify the public. So I guess this would be the notification. I believe we have 3 or more county commissioners that will be at the meeting. It's in the courthouse veterans room next Monday. 11:45, I believe, to 1 o'clock, or 11:30 to 1 o'clock. So there will be more than 2 commissioners in attendance. So
It's a good meeting if you guys can make it. Wide range of commissioners, from Sedgwick County, and they're,
Did I give you that I'd be there?
yes,
they're quite a bit more sophisticated
Yeah.
in some ways, sometimes. And then, we have other counties like Harvey that are very similar to us in size, and so I've always, it's kind of a round table thing where everybody talks about what they're working on. It's pretty helpful to hear, so if you can make it and show some hospitality for hosting, it'd be great.
If you would allow me to make one more comment regarding a public service announcement, I consider it, since we are supposed to be helping our citizens of Reno County, is those folks who may have elderly people they're looking after, or even if they're not, Medicare fraud is huge right now. We're getting, and this is a personal situation that I have seen, and I've made lots of phone calls regarding who can handle this, but these people are getting COVID tests, braces, and et cetera, unsolicited. Even one of them turned out to be a blood test out of Florida. And so if you do that, contact Medicare, and just as a kind of a public service announcement. Every month you get, they will get a copy of their Medicare, not a bill, but just a copy of the actions done there. And if you see something, for instance, our Medicare pays $94 and some cents on COVID tests, which are ridiculous right now for home test for someone of age. So if you do see that, give people a call. I've contacted lots of people and talked to a business down in Florida there's a fraud company right next to them. They're sending out 400 UPS boxes a day to people. That's all.
I guess I'm in the category. I'm the target. I'm old enough. My phone rings all the time. Same stuff. And I've become disgusted enough, I can't say how I answer. But bottom line is, Ron is right, and it's our tax dollars being frivolously thrown away. They come and get it from us, and the feds they know they'll hand it out. It's just, they start with their spiel, and pretty soon they got your number, and they're handing the stuff out, charging our government for it, and feds. And I saw it as a major problem a long time ago. It hadn't, other than getting the phone calls, it hasn't hit me, but that's...
If you get a package, keep it and call.
Who do they call, Ron?
You call the Medicare fraud line, okay? Takes a little while to get that information to them, but they've been excellent people to talk with that I've found. So I've called them about 4 times now on different things. So anyway,
I'm a little behind you on that, so would you get that fixed before I get there?
I don't know. I haven't got one either yet. So you got a ways to go. Okay?
I got a little ways to go. Yes.
Okay. Is that all?
Yeah.
Commissioner Clinton?
Okay, so the Reno County Sheriff's Department put out a notice earlier this week, and I got with the sheriff on it, and so there was a guy near a school and then there was a whole deal. They did make, it wasn't clear in their initial press release, and they did correct this, that the guy did brandish a weapon and fired shots in the air. And so I got several calls on that. I think just because the people I know worried about, we were going and somebody had a gun, and then we were going up and asking them questions and trying to create a problem where there wasn't one. But turns out in this case that's not the case. And I talked to our sheriff, and I appreciate the good work they did on that. So I did want to bring that up for anybody that saw that press release but didn't see the update. So there was that. So this next week, I'm meeting with Mr. Stanton. Going to try to talk me into, I think, approving your guys' revised deal on the courthouse. So we'll see. It'll be a hard sell to me to get me to spend $2 million or close to that on it, but we'll see. And also have been invited to visit with the chamber. So we'll see if we can't make that happen, and meeting with the sheriff, I think, later today. So just making people aware of who I'm meeting with. So if anybody's got any questions they want me to ask them, feel free to call me, text me, email me. Pretty easy to get a hold of, and I always do call back. Even if it's a spam number, I still call back. So, but yeah, so one thing that I would ask, and I'll send you an email on this later, is if you know things are coming in future weeks or months, if you can get me that information ahead of time so I can look at it, so I've got more than just a weekend, because a lot of my no votes today were just simply because I didn't have enough information. And I feel bad sending you a 3-page email every Monday saying, hey, what's this, what are we doing with this, what's that? And so anything that you can get me ahead of time, like, oh, hey, next month we're gonna be looking at this or something, would be much appreciated, so I can maybe join you guys on a couple of these votes.
Are you rolling through on some of your orientation type visits now? Is that what he's kind of doing?
He has gone through all of the departments except the district attorney.
Okay. Well, that helps a bunch. It really, really did when we did that, I think.
Yeah.
To see their operation.
I'm very impressed with a lot of what I'm seeing in the county, so.
And there are possibilities where we could, sometimes, for whatever reason, things are urgent, like deadlines and so forth, especially like, and I don't know, we could talk about putting a different deadline for requests for agenda.
The deadline is noon, at noon on Monday before the next Tuesday's meeting. So it's a little over a week. Then we have until Wednesday to get all the information in the packet. So sometimes we're waiting on that background information and then approval by the chair to keep it as is, the agenda, and that's why it is usually sent out Thursday afternoons. But if there's something big, I can send the information before the agenda actually goes out.
One thing we could do is just drop information, like you said, drop it earlier if outside of the packet, maybe.
Yeah, because when I was on the school board, they would do that for me because I was particularly difficult, and so they wanted me to give the information plenty of time to read it. And again, I don't mean to be difficult, and I don't think any of you guys think I am. I just, if I'm going to vote on things that affect 60,000 people, I want to make sure that I give them the due diligence that's required, and so at least from my own personal, what I think I should put into it. So that's it. But no, I appreciate you guys, and like I said, I've been very impressed with everything that's come to me before up till now, and so yeah, that's where I'm at.
Commissioner Weitzel, as a reminder, we have a meeting next week.
Yes, March 7th. Yes.
March 7th. So it's a week early. So we do not have a meeting the 14th or the 21st. Randy sent a calendar out, and it has some particular topics that we're going to discuss throughout the year based on the feedback we got from last meeting. So March 28th, we're going to talk about solid waste fees and the gas wells. April 11th is the Health Department strategic discussion. So if there's particular items on that, we should send them in as soon as you can so staff can work on that. And you don't have to write all this down. It's in the, it was in an attachment, unless you want to.
No, I was writing on something else.
Yeah. May 30th is wastewater regulation discussion. August 29th, we'll be talking about the fire district strategic planning, and October 31st is tentatively for a city-county water project. So, last meeting, I talked to staff a little bit about making our purchasing approval process a little more streamlined. They're still working on that. The thing where you have to sign every week seemed a little duplicative to what we're already approving in the consent agenda. So I think the same information would be sent out, whether or not we actually need a signature from each commissioner. They're working on a better, more efficient policy because it's been hard to track down 5 different commissioners for that. The RFP for the physician advisor to the county health officer is in draft form and likely will be in the packet next Tuesday. We'll try to get that out as soon as possible. And then I had a conversation with the sheriff and the county administrator with Senator Moran's staff yesterday related to the potential grant funding opportunities for the shooting range. They said we were right on time for this year's grant applications and felt like the project had merit to be included. They said to apply for the entire amount. So I was surprised at how much funding they do for law enforcement agencies in Kansas, but it was, what did he say, over 20 different projects?
20 or 30 projects.
They do yearly. So they were supportive of it moving forward, and we talked about some strategy for how the grant application would be written for best success, and I think we might use Sandra a little bit in the communications office to help the sheriff in his efforts. So, I think that's it. Any questions on those items? No? Okay. With that, we will adjourn.